Judge Glenda Hatchett, and President of the National Medical Association, Dr. Yolanda Lawson, MD.
Good afternoon, everyone. So I'm Yolanda Lawson, MD. I'm an OBGYN, actually, and it's such a pleasure to have this conversation with you all. This is a topic that's near and dear to my heart. And so I always like to ground the audience a little bit when we're talking about maternal health. And we talk about maternal mortality, and that's the death of a woman within 42 days of a pregnancy. And so I'm sure many of you have heard about some of the stats in this country, that Black women are 3 times more likely to die from a pregnancy-related cause than our white counterparts. Our Black babies are 2 times more likely to die than our white babies, right? And then even a college degree, so sometimes education, we've looked at that, it's not protective. Black women with a college education still have a 5 times higher rate of death than their white counterparts. And so we're gonna have a conversation today. We're highlighting what the problem is, and we're gonna talk about some solutions and some of the challenges also. And so I just wanted to root us just a little bit as we begin this conversation. And Judge Hatchett, I almost called you doctor, I almost gave you another degree. But I would like for you to just, let's explore some of the challenges with this audience.
Right. I'd like to frame it, if you would, and I thank you. You could have been anywhere else this morning, this afternoon, so thank you for coming to be a part of this important. And Dr. Lawson, I'm so grateful for all the work you're doing. We don't have a lot of time, so I'm going to frame this. I want to put a human face on this first. I never referred to her as my daughter-in-law. I always referred to her as my daughter. She walked into Cedars-Sinai Hospital and never walked out. Perfectly healthy, spoke 4 languages, had a pilot's license, was a marathon runner, raced cars, traveled extensively all over the world, owned 12 schools that taught Chinese in China. I mean, she was just an extraordinary woman and never left that hospital. She was butchered, and I did not know that the stats were so bad. I didn't know that we as Black and brown women were dying at such horrible rates. But this is the story I want to tell you to put a human face on this. They already had a 19-month-old. They had a brand new baby. My son is grieving. She's married to my son again. She was always my daughter. But the 2-year-old now, he's almost 3, wakes up one night. And he comes, I hear him wake up because I moved them back to Atlanta to live with me. And he woke up and I went in to see about him. And this is what he said to me, Dr. Lawson. And he was almost 3, but very articulate. He said, "Grandma G, do you have my mommy's cell phone?" And I said, "No, sweetie, I don't have her cell phone." He said, "I need you to find it. I need you to call God and tell mommy I want her to come home. I want my mommy home." That's why we're here. That's why we do this work. You hear me? Because we are in the business of sending mothers home with their children. I don't want any other babies to go through what they are going through without their mommy. And so, 3 times, the CDC is probably going to adjust that, we've heard, to 4 times more likely. I don't want any woman to die regardless of color, but we are dying at disproportionate rates. And what I do tell you, and I want you to hear clearly, is that 84% of these deaths, this is not me, this is not Sister Doc here, this is the CDC reporting 84% of all women who are dying after birth. It's preventable. You hear me? Preventable. And so if we know that, why aren't we doing better? And that's what this conversation is about today. We can and we must do better, because not only is this the social implication, because we're right here in the Black Economic Forum the economic implications for not just this generation, because a lot of these mothers are head of house. What happens to their babies? What happens generational? And that's what we're here to talk about today.
Absolutely. And so one of the things, if you don't walk away with many things today, so a lot of times I'm in Washington, D.C. a lot, so I do a lot of advocacy. I'm advocating for women broadly. One of the things, when you look at the United States and you look at high-income countries, all women in this country fare worse from childbirth than other highly developed countries, but it's just for our black women, we even have this more worse disparity. And this disparity has been going on over 100 years, right? It's hard to find hope, right? Because it's challenging work, but at least we are working towards public awareness. That's why another reason why we're here today, and I'm so excited we're on this platform and having this opportunity. Let's talk about some of the challenges.
Yes.
What are the challenges?
And you certainly, let me just say, I want to make sure you all know who this wonderful person is, right? I mean, you all have seen me on TV for years and years and years. She is the president, understand, of the National Medical Association. You know, and was just in the White House last week having conversations about these critical issues. So not only is she a practicing physician, an OBGYN in Dallas, Texas, she is advocating all over this country for us. And I want you to hear me say, I appreciate you.
Thank you.
So we don't have much time. Let's talk about the challenges. Challenges are the stereotypes. Kira had every advantage. She was at one of the world's greatest hospitals. She had insurance. She was not a poor woman who didn't get prenatal care, right? So forget all those stereotypes. But part of the problem is access. I live in Atlanta, Georgia. Georgia ranks 48th, 49th every year because also so many women don't have the proper access to medical care during their pregnancies, right? And then are ignored when they do show up at the hospital. Quick story. I was in Washington Monday. A journalist told me that there was a white couple. The husband ran down the hall to the doctor and said, "My wife is in crisis. My wife is in crisis." The doctor responded. The same doctor, the same hospital, a Hispanic man and a black woman. The Hispanic man ran down the hall to try to get help because his wife was in crisis. He got arrested. And the wife died. I can tell you a zillion of these stories. And so there has got to be a sea change in the way that medical help is provided and that we as black people are not ignored. So the challenges are going to get worse during Roe, right? Because now there are women who are forced to carry pregnancies that they wouldn't carry and are going to be in trouble, and for whatever reasons, right? 53% of the women die after they leave the hospital. Think about that for a minute. So what the call to action today is in your states, how long does Medicaid provide support for women postpartum? How long? 6 weeks is not enough. Dr. Lawson can speak to that better than I can. So we've got to lobby for Medicaid to be extended. And then, should I go into the HHS thing about the...
Sure.
So the HHS, this is shouting news. Shouting news. I'm about to stand up on this one. I'm going to stand up on this one. Shouting news. HHS, for the first time in the history of this country, has opened an investigation into Cedars-Sinai Hospital. Yes, sir. It took us 7 years. I've been in Washington, D.C. more since Kira died than I have been all together in my life. And my son particularly, and I'm going to sit back down, because, you know, I'm black and Baptist, I get to going. But what I'm going to tell you is that they are now investigating the disparities between black people, women dying, and white women dying after childbirth. And until the federal government ties funding, you hear me? Federal dollars to outcomes, we're not going to see a difference. And so that opened up last May of 2023, and that's the good news I've come to share with you. Because if we can see a sea change there, and it doesn't get undermined after the election,
Right.
do I need to say anything else on that?
No, you said it.
So that investigation has to go forward, because with that investigation, it will be a domino effect so that federal funding for all hospitals in this country will be tied to outcomes and the disparity against black and brown women. And that is some shouting news I've come to tell you about today.
So I want to reiterate something she said, because it's important. Again, you guys walk away with pearls and nuggets. 53% of maternal deaths occur the day after birth. So many people focus on just the birth process and labor. That's important. 40% of women don't receive postpartum care.
40%. Did you hear that? 40%.
Do not go back for that postnatal visit. So when you're talking about the legislative win over this last few years has been the extension of postpartum Medicaid, right? And so the largest insurance payer in this country for births really is Medicaid. So we know we can move those numbers. And so when you think about that many women not achieving postnatal care, what's killing people after birth? Cardiovascular disease,
Right.
mental health, and blood clots. It's imperative that folks get that care after the fact. Right now, there are about 3 states that have about limited restrictions on that. One state, Arkansas, doesn't have any of the extension. The rest of the states are following suit. That's reassuring, and that's a win. So we're going to pivot a little bit, and let's start really exploring and talking about what are some of the solutions to this problem.
Right.
So I'll tell you, I'm an OBGYN, I'm a black female OBGYN in the South. 6 or 7, 8 years ago, we've been advocating. You heard me say black women have been dying for 100 years. We've been advocating just for the awareness around this. And so I thought, well, now that everybody knows, the government knows, agency knows, we're going to fix it, right? No one's figured it out to this point, right? That's a problem. People are investing in it. I think HHS is, CMS, there are some programs, but we must do more. And so let's talk about some of the solutions that we see to move the needle. Because you're talking about life and death. We're talking about moms and babies. For me, when you think about maternal and infant health, that's the most important marker of the health of a society. And so solutions. You mentioned some of the restrictive reproductive health laws. For me as an OB-GYN, for me, the manifestation is the impact it's having on obstetric care. So what happened when these laws start going into effect? We start seeing more deaths. And remember, a woman can die first trimester, ectopics, you can hemorrhage from a miscarriage. So let's think about, as you go back to your local areas, you're advocating, let's think about what we're really advocating for. And what I'm talking about, for me, I framed this broadly around women's health, right? Maternal health is a piece of that, but if you have a child, and let's say you do survive, but you survive and you're disabled, that's still a problem. I want women to leave the hospital whole, and I want their babies to leave the hospital alive and able to thrive. So I'll let you give a little bit of, ask your perspective on some of the solutions that we need to be pursuing in this country.
Right. First of all, it's the whole adage that if we know better, we're going to do better.
Right.
And so I considered myself well-read, but I did not understand until Kira died in 2016 that this was an issue. I honestly did not know that this is an issue. So that's why we're sounding the alarm, and we have to continue to have these conversations, but it's not just enough for us to be stuck in just, oh, it's terrible, and wringing our hands. We had to move forward. So my challenge for all of us today is to go back and research your states. What is happening with the Medicaid provisions about postpartum care? And if it is not at the 12-month mark, then I need you to be working with the women's caucuses and your state legislatures, with advocates, with the medical associations, with the law associations, because we need to all be in this conversation to change the tide. Then secondly, from a legal perspective, because that's my wheelhouse, is that I just to be honest, for a long time, I could not take on these cases, Dr. Lawson. It was too raw, it was too hard, it was just emotionally too hard. I'm at a different place now. I'm prayed up about this, and I am in it. I am in these fights, and I am taking on maternal death cases all over the country. But I'm not going to do them traditionally. This is very important. I'm not suing just on medical malpractice grounds. I am suing on civil rights grounds. I am bringing civil rights claims because of the disparity. You can't tell me that as a brown and black woman that we walk into these spaces and that we don't come out and our white counterparts do. If that is not discrimination, if that is not a continuation of the discrimination that we have seen historically in this country, I don't know what does. So I'm doing it very differently. I'm catching hell, but I don't care. Because until there's accountability and until there is change in this nation, these little babies will still be waking up wondering why their mother can't come home from heaven. I can't explain that. I'm a grown woman. I can't explain why Kira's not here and why she's in heaven. How do I expect a precious child to understand this? We're in the business of sending women home. And then there was something else we were going to talk about the strategy. What else were we going to talk about?
It's okay. I pulled some numbers for y'all.
Okay, all right, good.
I looked at, we're in Louisiana, so I have to honor Louisiana, right? 37% of the births in this state are black women, but black women attribute to 65% of the deaths. So when we say go back home,
yeah,
go back home and really look at what's happening where you are and advocate with whoever you want. Advocate with the black doctors, the black nurses. We're all trying to solve this problem. Come in with a solution base.
Right.
Because the U.S., right, we're the powerhouse of this world. And if we can't solve this problem, as much money as we spend on health care, right, if as much money and the resources that we have and the things we're able to do. And so for me, this is a value proposition.
Yes. It is a value proposition. And think about it. If we're losing black mothers, what is the implication for our black communities?
There you go.
If we are losing black mothers, 84%, I'm going to say it again, I'm going to keep saying it, 84% of these women who are dying, it was preventable. It was preventable. And so as my son reminds me, Mom, that means that we've got a lot of good work to do. That if there's 84% of them dying, then that means that we got 84% that we ought to be saving, and that has got to be our mentality. Last thing quickly is that don't go into a hospital alone. Have somebody.
Have an advocate.
Got to have an advocate. And my son was advocating, but you know what Kira said? Baby, don't get upset. I don't want them to she was afraid that they were going to get with him and put him out. I had left the hospital with the baby to go home, the 19-month-old to go back to the condo. If I had been there and understood all of that, I would have turned the hospital. I probably would have gotten arrested. But my point is, we've got to be smart. We've got to advocate. Don't go. And if you're in labor, you got to have somebody with their shifts. The person gets tired, they go home, they can't leave you there. because you got to have somebody advocating. Even though Kira had advocates, she still died. And we have a chance to change this. And I'm so grateful for Alfonso and the team really putting this together. I don't see him, but I want to thank you for doing this.
We want to thank Alfonso and the Global Black Economic Forum.
Yes, thank you, because this has very serious, not only social implications for our families, but serious economic, because how many of y'all know black women who are head of household? You see my point? So if we're losing them, then what does that mean for the vitality, the viability, economic viability of our families? Because I did want to bring it back to the economic piece. And you see that sign behind you, vote. If you all saw me yesterday, I came in with my vote t-shirt. Now, let me tell you, I do wash it, but I'm wearing that from now to November. We have got to vote. Too much is at stake. Thank you.
Thank you all.